Welcome back to APP 2015. I'm talking to Anthony Tassone, the President of the Pharmacy Guild of Australia's Victorian branch. Anthony, the theme of APP 2015 is transforming pharmacy, the opportunities and challenges. What does this mean to you?
It can mean different things to different people, and that's the beauty of the theme, but it's about challenging ourselves to step out of our comfort zones, being out the front of our dispensaries, being in closer contact with our patients and consumers. It's about expanding our role into different areas. Here in Queensland, where we have the Queensland Pharmacist Immunisation Pilot, in terms of vaccinations and immunisations, that's also been legislated in South Australia and Western Australia. And there's many other great innovative things that pharmacies are doing across the country around medicines management, and we did see that from our Pharmacy of the Year finalist also.
Absolutely. I mean, there was a lot of variety demonstrated by them, and I mean, it's interesting you bring up the vaccination program, and that is a ringing success for pharmacy and what it does. It's
a ringing endorsement based on overseas experience of where pharmacy can play a key role in preventative health. We're the most accessible primary healthcare destination in Australia, and there is an evidence base with appropriate training where pharmacists can play a really big role for a sustainable health system and expand our role.
Now, and thinking of the theme, we do hear a lot about the negatives in pharmacy, but considering we're talking about the opportunities, what are some of the key opportunities you see for the profession?
Quite a few, and our National President, George Tambassis, touched on a few that we're actually taking forward in our 6th Community Pharmacy Agreement discussions and broader advocacy around the core competency of pharmacists around medication management. So, for example, there's a lot of evidence from overseas that when a patient transitions from care, when they come out of a hospital and come back into the community, they are at great risk of being readmitted to hospital when their medicines aren't reconciled and managed properly. But with pharmacist intervention, we can prevent that from happening. So we're demonstrating to government, both at federal and state levels, how with pharmacist intervention, we can save a lot of money in the health system, remunerate pharmacists appropriately through our proposals, and make a big difference to consumers.
And speaking of that government role, or the government recognition of the profession, we've just heard today from Susan Lee, the Health Minister, speaking to APP 2015. For the benefits of those who can't be at the conference, Anthony, what was your take-home message from what the Minister said?
I think the Minister was very clear in saying the value that the federal government has for community pharmacy and the work that pharmacists do in being an accessible primary healthcare destination, particularly in rural and regional areas, and they want to support the role of community pharmacy through the next agreement. She did caution, though, that due to the budget pressures and challenges that the federal government's faced with, that there is no area exempt from further reform or savings considerations, and the PBS included. But she is very open to listening, and she's engaged in discussions with the Pharmacy Guild around the 6th Community Pharmacy Agreement and with other stakeholders to take their feedback. And it's a significant challenge they face, but it's fair to say that Pharmacy Guild is putting forward our proposal to make sure that the government is aware pharmacy's done the heavy lifting through reform, and we will put forward proposals to expand our role that will save the healthcare system and deliver ultimate value to the government and the consumer.
But in what she said, though, there was that but there as well. So, I mean, do you see that as being a potential problem, or is that something the Guild can work with the Minister?
Absolutely work with the Minister. She's already shown a strong capacity to listen, to engage, and I think that in fairness, being a representative of the government, the major payer and funder of health services, that they need to be in a position to responsibly pay for these services. And what we will show at the Pharmacy Guild and put forward a case is that pharmacy is worth investing in and reinvesting in based on the significant savings they've already made through PBS reform and our proposals through the 6th Community Pharmacy Agreement period of how pharmacy can make the health system more sustainable and deliver more outcomes for Australians.
Now, Anthony, many of our readers will know you through your regular posts on our social media forums.
Yes.
You are quite willing to engage in debates with people from time to time. And what do you see of the role of social media in pharmacy?
I think what I personally love about social media, in particular Twitter, is that you can engage or call out to really anybody who's also on that platform. And what's interesting is some of my colleagues within the Pharmacy Guild or members of the Pharmacy Guild say, why do you bother engaging with these detractors? And
you certainly do get us some good stoushes with them, that's for sure.
Yeah, and to be completely honest with you, there are some people on the forum that I know that I'm never going to change their opinion. And I'm not trying to in all cases, because everyone's entitled to their opinion. But I'm mindful of all those people. The majority of people register on forums but don't post themselves. I'm mindful of those people who don't post but are reading. And there are a vast majority of pharmacy owners or many pharmacists who have a point of view, and I try to give a voice to a segment of our profession that doesn't necessarily post, but also I'm speaking to that segment who don't necessarily post. And if something is not challenged on a forum, it can get purported as fact. And I'm very mindful of trying to provide clarification and trying to, in simple terms, on some matters, set the record straight. But you're not going to win every battle, and nor do I try to.
But I think, as you point out, it is important to get the other point of view across sometimes, because these things can take on a life of their own. So,
look, absolutely, and it is important that people are entitled to their opinion. I think it's best to have an informed debate, and unfortunately, in my opinion, there are at stages people who are not informed when they're contributing an opinion, but they're entitled to that opinion, and as long as they're prepared to listen to other points of view or refer to evidence or whatnot, I think that it's a good thing, and I think it has the opportunity for greater collaboration and greater thought-provoking ideas.
And thinking outside of like pharmacy media, do you think there is a role sometimes too for pharmacists to engage in the same sort of discussion with people outside the profession on general media sites?
Absolutely, and there is just so many different opportunities to do that. It is difficult to manage the time to do that, but at the Guild we take every opportunity that we realistically can to engage in mainstream media. I do it myself from time to time, and I think it's important because pharmacy has a good story to tell, and pharmacists continue to rank as one of the most trusted health professionals across Australia. And despite some detractors in the media that many of your viewers or readers would no doubt know about, it doesn't ring through to the grassroots community level because of the high regard we're held in, but it's important for that to come through as a voice.
No, I think that's definitely true. I mean, I think that as recent times, the petition showed that the general public does respect what the profession does. I think that's a given. So.
Absolutely, and as effective and as passionate as the Guild are in advocating for our profession, I can say this, that if it wasn't for pharmacists doing a great job on the ground, pharmacy owners and their staff, we wouldn't be effective in our advocacy with political representation and other stakeholders, because ultimately it's that consumer experience with pharmacists that makes a difference.
Thank you for your time, Anthony, and I think everyone appreciates the passionate voice you are for the profession.
It's been a pleasure, Chris. Thanks for having me on.
And we'll be back with more from APP 2015 from Pharmacy News.